Hello and welcome to the cranial nerve lecture. So in our last lecture we talked about the brain and brain parts, but coming out of the brain are all kinds of nerves called cranial nerves, and this is what the thrust of this lecture will be about. If you take a look at a bottom view of the brain, you can see all of the various cranial nerves that you're going to learn about. So you have to imagine for testing purposes, you're going to have something like this, a diagram like this, and you have to label all the cranial nerves and know what all the cranial nerves do. So this is a view of all the cranial nerves that are labeled for you. So by the end of this lecture, you should be able to know all the cranial nerves, be able to identify where they're located and what jobs that they perform. This is a picture showing you the cranial nerves and what they actually look like in the brain. So this is a real brain, and the cranial nerves you can see are kind of a tan color. I mean, I'll just kind of highlight a couple of them for you. So you can see they're kind of a tannish coloration coming out here. And I'll tell you, they're very challenging to find in a various dissection. A lot of times they get ripped out real easily when you remove the meninges over them. Just showing you a couple of pictures in relation to parts that you've already learned. So if we take a look at this kind of lateral view of the diencephalon and the brainstem, you can see the various cranial nerves. Not all of them are here, but you can kind of see where they're coming out, and from a lateral view, where they come out or enter into various brain tissues. If we look at an anterior view, you can see where some of the cranial nerves are located. Here, 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 and here, and here. So anteriorly, you can see a lot of the cranial nerves really well. From a posterior view, you can't see too many of them. They're mainly more of an anterior phenomenon, but you can see one of the cranial nerves there, cranial nerve number 4. So these are the names of the cranial nerves. You should know what cranial nerve number 1 is called. And what I'll do here is tell you their names so that you can, in your mind, say them correctly. So cranial nerve number 1 is called the olfactory nerve. Cranial nerve number 2 is called the optic nerve. We then have cranial nerve number 3, the oculomotor nerve. Number 4 is the trochlear nerve. We have then cranial nerve number 5 is trigeminal. 6 is abducens. 7 is facial. 8 is vestibulocochlear nerve. 9 is glossopharyngeal. 10 is vagus. 11 is accessory, and 12 is hypoglossal. What I'd like for you to do now is just stop the video for just a minute, and I want you to make up a mnemonic that is a learning device where you use the first letter of each of the nerves, make up a sentence, make up a little song, make up a mnemonic that can help you to remember in order at least the first letter of each of the different cranial nerves. After you pause this for a minute and practice, I'll show you a good one that I like to use. So this is the one I like to use. I like to use this one. So I made a little sentence. On occasion, our trusty truck acts funny. Very good vehicle anyhow. So each of the letters of the first letters of each of the words in my mnemonic represents the first letter in each of the different cranial nerves. It is important to use some kind of learning device to remember the order of the cranial nerves so that you will do a nice job on them when you have a test. This is just a diagram showing you some of the cranial nerves we're going to talk about. If they're sensory or motor or mixed sensory and motor, and then what their primary functions are. So your textbook has some nice, summary tables that you can take a look at. Okay, so our first cranial nerve is called the olfactory nerve. Olfact, if you look at the root of that, means to smell. The olfactory nerve is located, if you look at the bottom of the brain, you can see it's located right here, and it's in yellow here. That's actually the part called the olfactory bulb, but it is cranial nerve number 1. If you look at the cranial nerve, so this is looking from a sagittal view here. Here's the cranial nerve. It sits right there on top of where the cribriform plate is. The cribriform plate, if you remember, is part of the ethmoid bone, and it's little holes in the ethmoid bone. So there are axons that extend down and through there, and there's nerve cells that are actually receptor cells that are in your nasal cavity. So when you have little odor molecules, like these little dots are representing, you can sense those by these olfactory receptors. They then send the information through the cribriform plate, and they will then pick up on and connect to nerves that make up part of the olfactory tract that you can see right here. Okay, so without the cribriform plate, the little little receptor cells wouldn't dangle down into your nasal cavity, and you wouldn't be able to smell different things that are in the air. This particular nerve is sensory exclusively, and it aids in the sense of smell. So it sends information back to the temporal lobe in order for you to be able to smell whatever's in the environment. All right, well, cranial nerve number 2 is optic, the optic nerve. Opti means eye or vision. This particular nerve is sensory exclusively, and it senses light signals that are coming or entering into your eye. So if you can see, light comes through, and it's going to strike the back of your eye called the retina. So as light comes through, it strikes the back part of the eye called the retina, where you have rods and cones. These particular things sense the information. So rods and cones, here is a cone, here is a rod. These sense the information, and then they send the information via optic nerve all the way to the back of the brain, which is the occipital lobe. It's kind of interesting, but as the information comes from your eyes, it bifurcates, and part of it goes this way and part of it goes this way. So you actually send part of your visual information to the left side of your brain and the right side of your brain at the same time. We'll maybe talk a little bit about that when we do the senses later on this semester. Oh, just showing you here, let me ink this out, or get this inked out. So there is a place where things cross the optic chiasma, and the optic tract carries information to the occipital lobe. Well, eventually to the lateral geniculate nucleus of the thalamus, and then to the occipital lobe of the brain. That's the cerebellum, but it would go to the occipital lobe. So the oculomotor nerve is cranial nerve number 3, and oculo, you can see it has oculo there and motor. Oculo means eye, motor means to move. So the job of this particular cranial nerve is to service both of your eyes, and it controls 3 eye muscles, and it controls the muscles that will regulate the size of your pupil. So the 3 muscles that it innervates is going to be the rectus. That didn't highlight like I thought it would. So let me go to highlighter. Let me move my face. So it's going to let me erase all the ink, and let me go to that highlighter and see if I can do this. So it is going to innervate the superior rectus muscle. It's going to innervate the inferior rectus muscle, and it also innervates the medial rectus muscle. And these particular muscles are going to be important in helping to rotate your eye. So if you were to get damage in this particular oculomotor nerve, you would lose really control of many of the ways that you can move your eye, and you probably would be seeing double vision. Is probably eventually what you would be seeing. If it damages your pupil, then you wouldn't, or the part that goes to the pupil, then you wouldn't be able to regulate your pupil size. So that's the oculomotor nerve. The trochlear nerve is going to control the superior oblique muscle. So really it only controls one muscle, the superior oblique muscle, and that muscle is going to be involved in allowing you to look kind of down. So if you get that one messed up, you can't really look down. The reason they call it the trochlear nerve, trochlear means a pulley, and this muscle has a little trochlea that it goes through, and then it attaches to the eye. So when it contracts, it pulls the eye kind of down or inferior laterally, is how that some people describe that. All right, so that's the superior oblique muscle. And this particular nerve is exclusively motor, so it just has a job of contracting skeletal muscle tissue. All right, well, cranial nerve number 5 is the trigeminal nerve. Tri means 3. There's 3 branches to it. There's the ophthalmic branch, there is the maxillary branch, and there's the mandibular branch. Each of these branches of the one nerve called the trigeminal nerve are going to service different parts of your body. For example, the ophthalmic branch is going to service kind of like your forehead and eyelids and little part of your nose, and that's going to be mainly sensory. There is a maxillary branch that's going to be sensory, sensing things like pain in those areas, pain in your sinuses and teeth. And the mandibular branch is going to service many of the muscle tissue, much of the muscle tissue that you can see here, here, and here. Okay, also services a little bit of your tongue. So really, it is mixed, so sensory and motor. It controls chewing muscles, pain sensation in your teeth, and then sensation in the eyelids and the skin of your forehead. So many jobs that performs. Of course, if you knock out any of the branches from disease or surgeon cut or cutting it in an accident, then you'd lose the functions that those particular nerves would be servicing. And this is just showing you kind of a little bit of a picture of the general area that the ophthalmic branch kind of is controlling. The maxillary branch is controlling kind of this region of your face. So there's a map, and then the mandibular is this portion down here. And you can see that the ophthalmic region, the maxillary region, and the mandibular region. So the abducens, ab means away, ducens means to lead. So this is going to control the lateral rectus eye muscle, which is going to pull your eyes to the side. So side-to-side movement of your eyes would be lost if you didn't have the ability to control this cranial nerve. And so there's a lot of the cranial nerves that service the eye. You can see the oculomotor services the cranial nerve. Services the eye. The trochlear cranial nerve services the eye, and so does the abducens. So this kind of graphic shows you what they each are going to stimulate. The facial nerve is going to be mixed, so it's motor and sensory. It controls the muscles of facial expression, also controls salivation and lacrimation. Salivation is the production of saliva. Lacrimal secretion or lacrimation is the production of tears. So it does have some sensory roles. It does have also some motor roles. You can kind of see in this graphic some of the muscle tissue that this one, the nerves are penetrating into. So a little bit of the tongue there, and so that's what the facial nerve does. Of course, when you get a damage in the facial nerve, you're going to have a drooping face. So if you have a stroke that destroys this particular nerve, or some kind of nerve damage like a viral infection, you might have Bell's palsy. This is going to affect that nerve and cause one side of your face to droop unless the viral infection's in both sides of the face. All right, well, cranial nerve number 8 is the vestibulocochlear nerve. There are 2 portions of it. There is the vestibular nerve. Let's see if they have the vestibular nerve here. So they have the vestibular portion, or vestibular nerve, and then there's the cochlear portion. The vestibular portion's dealing with equilibrium, the cochlear portion's dealing with hearing. So this is mainly a sensory nerve, and it deals with hearing and equilibrium. So your ears don't hear, they just sense information, send it to the part of the brain, the temporal lobe of your brain, to actually have that sense of hearing. So the glossopharyngeal nerve is, so gloss means tongue, pharyngeal means throat. So this is a nerve that has mixed functions, sensory and motor, and it senses touch pressure and pain from the pharynx and back portion of the tongue. So it does have some motor control as well, but mainly touch pressure and pain. Sorry about that. Let's go to cranial nerve number 10. This is called the vagus nerve. Vagus means vagrant or wandering. And this nerve, once it comes out, it's going to wander all around. It's going to go to your heart, to the back of your throat. It's going to go to your lungs, larynx, digestive organs. It is sensory and motor, so it's a mixed nerve. And it does regulate large core things like heart rate, breathing, digestion, swallowing, vomiting. It has a huge number of jobs it performs. So this is a really critical and very important job that it's going to be performing. Cranial nerve number 11 is the accessory nerve. The accessory nerve is going to be motor in function, and it contracts the trapezius and the sternocleidomastoid muscles. So those are two jobs that this particular nerve services. And then lastly, we have the hypoglossal nerve. Hypo means below, gloss means tongue. So it comes in underneath the tongue, and its job is motor in function, and it controls tongue muscles. There are many ways to learn the cranial nerves. It's not an easy thing to do, but first of all, having a mnemonic so you can learn cranial nerves number 1 through 12 in sequence goes a long way to helping you. Another thing might be to look at images. We call these visual mnemonics. And if you notice, like, for example, cranial nerve number 2 is involved in vision. So the person drew this with the number 2 right there. Cranial nerve number 1 is involved in smell. So each of these numbers essentially corresponds to the cranial nerve number and where it is going to have its activity. So that might be useful to you to look at a visual mnemonic of the cranial nerves. And again, you can go online and type in cranial nerve mnemonics or cranial nerve visual mnemonic and get some of these images. Here's a couple more I pulled off the internet. So this one's very simple here. Cranial nerve number 8, vestibulocochlear, is involved in hearing and equilibrium. So cranial nerve number 11 is going to be involved in the trapezius muscle. So you can kind of just generally see where these things are and what job they're performing. This is another one that was more artistic, so you can see what it looked like. Also, we'll put a video online for you to take a look at. So take a look at that and get into the cranial nerves. We'll talk about them in lab. And if you have any questions or need anything, please let me know through email. So until I see you in class, or until I see you next time online, I wish you a good day.